You're tuned to KFUG, Crescent City, kfugradio.org. Also, usually at 101.1 FM, but that's not happening at the moment. Hopefully, that situation will be remedied soon. I'm Mike Thornton, sitting in for Paul Kritz in this hour of community service. Paul had to go do some Hell World Zoom thing, but he bravely faced the music and the computer screen. We're joined in the studio by Lynn Szabo, PA at large, PA all over the community, and of course, our regular guest and expert on health matters. Lynn, thanks for being with us in the studio today.
Thanks for having me.
Really appreciate it. Yeah, so we've been doing a lot of talking about COVID, and in some ways more on the larger scale in our community, the macro scale, if you will, about the number of people hospitalized, the broad number of cases, all of that. But what you're here to talk about today is what an individual might need to do if they think they have COVID-19.
Or if they have the diagnosis. So this is the advice that you would get if you had 24/7 access to me and your COVID questions, and you could just call me up and talk to me. This is the advice I would be giving as a medical provider.
One more reason why you should support KFUG Radio. 24/7 medical attention. So then, please, let's go through this, because I know you have a list, and we can go through it and kind of talk about what these things really mean as you make your way through this list of what people should know.
So the first thing, and I know we've talked about it before on Health Matters, but the first thing is that if we should clarify the difference between isolate and quarantine, because they're used interchangeably, and it's really important to get the separate definitions separate, because they mean different things.
Absolutely.
So if you as an individual just get your COVID test result back and you're positive, you should expect to isolate for 10 days. So isolation happens when somebody has a positive test, and it's 10 days. So this means you should not be leaving your house unless you're seeking medical care, and that you should have friends set up or delivery services set up to bring necessities into your home. So there's a little bit on Facebook saying that the public health people are kind of sanctioning people still doing errands and things. That's wishful thinking and not true. Okay. But the next thing is quarantine. So what if you're a mom and you have a sick kid? That kid is going to isolate for 10 days, but you as the probable caretaker of that kid are going to have to quarantine 14 days. Whether you have symptoms or not, whether you have a positive test or not, you'll have to quarantine for 14 days after that kid's 10th day. So that means a working mom or a working dad could be out of work for 24 days, which is a long time. Now, there's some modified quarantine isolation rules, but they're kind of made up by employers and not really what the public health department is telling us to do.
I think a lot of people think in terms, when they hear the word quarantine, almost as if that's something imposed on somebody by someone else. Someone else says you're going to be quarantined now,
right.
But that's not the way you're using it at all.
No, I don't think there's guards at your door or anything, but I do also think that the ethical consideration here is to do what you're told, because you don't want to bring this to somebody else. You don't want to be responsible for a new chain in the community that's going to result in a death.
So let me ask you this, and I realize it's a bit of an aside.
Mm-hmm.
School started yesterday. How do we know that people are isolating and quarantining appropriately when we have all of these young children and older children making their way into these congregate settings?
Yeah, so they really aren't. That's why I bring it up. They really aren't. And people are trying to justify modified things and try and do that because it is really hard. I mean, it would be really hard for me at home to isolate. I'm a single person living with my animals and stuff. Luckily, I anticipated this March 2020, and I kind of built up my pantry and stuff so I could do okay. And luckily we have DoorDash now, which is kind of a a good service to the community in this particular time.
Well, and all of this is predicated on the fact that the person or the family has
resources,
the financial and other resources, and able to actually be able to do this.
Right. And the other thing too is that they had some anticipatory thought about it. But I will say that a lot of people that are being told they're positive are absolutely shocked. They didn't see it happening to them. Despite vaccination status, they didn't think it was a real thing. And so they're really being kind of caught off guard.
Sure. Okay. So if you would like to continue, we could do that.
Yeah, the next thing is focus on fever control and hydration, especially if you're taking care of a child. So one thing we know that the initial assault against COVID in the human body is with the innate immune system. And in a kid, an innate immune system is a really well-functioning thing, but it relies a lot on fever. And we have kind of grown to, since we have ways to treat fever that are really effective, we've kind of grown to be intolerant of fever, even though for a kid it's kind of their best way of fighting a viral infection. And they do get quite high fevers. Now, an occasional kid will have a febrile seizure, which is terrifying for a parent to see, but in the long run, not a dangerous thing. So you're trying to find a middle ground between having enough fever so that the virus has taken the hit from it, and not too much fever that you might be at risk of causing other problems.
So this may be a completely inappropriate question or too difficult to go into at the moment. Why is fever this sort of first line of defense for kids? What makes that?
That's because there's two kinds of immune system, like I just said, innate and acquired. And kids are born into the world without much acquired. So their innate it's just kind of in hyperdrive. And especially, kids when they're, I would say, teenagers and younger, they mostly are getting viral illnesses. And so that's just, we've kind of evolved to have kids have an immune system that reacts like that. There are other things going on too, but the fever, that's why kids get such high fevers. I don't know if any of the parents in the room remember watching kids overnight, because the fever looks really scary. The kid doesn't feel well. The kid's really not bouncing around like they should be. It's a real departure for what, we hope our kids look like.
Yeah.
And there's a big tendency in the community to try and get rid of that. And there's an intolerance of fevers, even like in the low 99s. But I'm saying try and hold on and not treat a fever until it's over 101.5, unless the kid has a pain issue, in which case it makes sense to give them Tylenol. Ibuprofen is okay too, but most pediatricians go to Tylenol first. Okay. And then the next thing is, if you can get it, and I know UHS is handing them out, try and get a pulse oximeter. So anybody who's been to the doctor probably in the last 15 years has had that little thing put on their finger, and we get two pieces of really important data from that. One is we get the percentage of oxygen in the bloodstream, which is really, if you're, especially with COVID, because hypoxia or low oxygen in the bloodstream is kind of a big thing. And that kind of is an early indicator that somebody's going to go on to more complex disease. But you also get a pulse, which is kind of good. And if somebody's dehydrated, for me, I can use the pulse as a really quick and dirty way to have some empiric evidence that somebody perhaps should consider going to a place where they can get IV fluids versus staying at home and getting oral hydration.
If somebody wanted to have one of those in their home, where could they buy one, and what would they cost?
They're pretty cheap. You can get a reasonable one for $20. They're, there's always Amazon, but really you could get it at Walmart too. I don't think they have them at Safeway, but it's probably worth asking. But it would be really important to invest in one. Now, you could get a medical grade one like they would use in the intensive care unit and pay $100 or something, but that's not really necessary. They're really sweet little pieces of equipment that give us important information, and they're widely available. UHS is giving them out. So if you get tested at UHS and get a positive, remind the nurses to hand you one, because they'll give it to you for free. They're trying to get them out there in the community.
That's cool.
Yeah, it is cool. Yeah. So what is the reading? So what's a PO2? So go back to, like, I don't know, 5th grade and how you got graded, okay? And think of a percentage. So you always wanted to get, or at least I always wanted to get the 90 to 100%, right? Because that's a classic A, okay? For kids, you want 95 to 100%. That's preferred. Kids we become a little bit more worried about them when they're in the low 90s. That's the time when you have consistent low 90s. That's when you ought to be calling a doctor and getting the next step planned out. For adults, upper 80s represents the problem area.
And just to be clear, for me, we're talking about the percentage of oxygenation in the blood. Is that what? Okay.
Yeah, it's a percent. Yeah, and so try and think of it as grades. You want the highest grade possible, right? So look for kids anything in the low 90s, for adults anything in the upper 80s. Now, sometimes there's a little error in the system, like somebody wearing fingernail polish might make the pulse oximetry artificially lower. So don't measure it on a finger that has nail polish. And for kids, especially a little kid, like if you were going to put it on a 12-month-old, probably goes better on the thumb or even the big toe, if they'll let you do it, okay? Because if you use, their index finger, it's just too small. Even the middle finger is too small. So a thumb's the way to go.
So the issue with the nail polish is the off-gassing of the chemicals in the nail polish?
Mm-mm.
No?
It's the obscurity.
Oh, okay, because it adds another layer of sort of like lacquer over.
Right.
Right, okay.
Yeah, so you can throw one of these on a person that's got like acrylic nails and then be momentarily terrified until you figure it out. Okay. So next thing, we're on item number 5. So vitamin C is important, but not in super high doses. You really should get plenty from your regular diet. So if somebody is sick and not really feeling like eating very much, try and look for opportunities to have vitamin C rich foods. So like orange juice, maybe watered down a little bit if they're a little sick to their stomach, strawberries and kiwis. There's a lot of fruits and vegetables available right now. Kind of pay attention to what might have more vitamin C in it and make it available.
What would be an overly high dose of vitamin C for a child or for an adult?
Right. As far as children go, I don't think they need more than like a gram a day. So I don't think you should go get them necessarily like, what are those, NRC, that have like,
oh yeah, sure. I know what you're
like 5 grams or 5,000 milligrams of vitamin C. I think an adult could take that and probably do okay with it, but it's really not necessary. You're going to be peeing it out, and it's kind of expensive. So I would stick with dietary. I think that's fine for this particular thing. So here's another complex thing that we have here is that people live in small houses, oftentimes only have one bathroom. So ideally, the sick person should be sequestered in a bedroom, and they should be wearing their mask anytime they're outside the bedroom, but they can go maskless inside the bedroom as long as there's nobody else in there who's at risk. But then the bathroom is where there's a problem. Ideally, the sick people should be isolated to their own bathroom. And I've heard of people like wiping it down afterwards, which I think is kind of a good idea. For nothing else, it helps with anxiety. But the toilet the lid has to be down before you flush. And that's a huge big deal because if you think about it, COVID virus aerosolization is like the mode of transmission. So it's not so much about wiping all the bathroom down. It's as easy as dropping the lid before you flush. Doesn't matter what's in there. I mean, you could just flush water.
Right.
And there's enough viral particles in there, and the rapidity that it goes up into your face after you flush is like microseconds. So it's kind of disgusting if you think about it. So close the lid before you flush. And that's going to be hard for kids to remember. So the adults taking care of them should probably take charge of that.
Yeah, I think I remember seeing something about how when you flush the toilet, the amount of stuff that's like aerosolized into usually a compact space,
Right.
like a bathroom, you don't realize how much stuff is getting pushed up into the air when you do that.
Right. And it hangs right at about where we breathe.
Of course.
They've actually measured that, so it's disgusting on so many levels. But anyway, another reason I believe in the immune system. So sick people, I said this should be in their own room, and they can be unmasked if there are other COVID negative people in the house. They should be sequestered. So signs and symptoms of concern are change in level of consciousness if somebody is like not making sense. Now, parents will oftentimes identify a kid as being lethargic when what they really mean is he's not like tearing the room apart, which would be his usual level of behavior.
Right.
Lethargic means something different to us in medicine, but that's okay if you're comfortable using that word because it describes what you're seeing, then go ahead and use it. But we don't always buy into it if we see something different.
Well, when you use the word lethargic as a medical person, what does that mean to you? When you hear it as a medical person?
That means a kid that's not responding. So when I when I walk in the room, the kids should respond to me. And they sometimes respond to me by smiling or handing me stuff if they know me, or sometimes they respond by hiding behind their mom. So when I walk into the room, if I'm looking at a sick kid, I'm already evaluating how, from the second I walk into the room, how they're interacting with me. If a kid's just lying on the table and doesn't really even care that I'm there, that's lethargic.
Okay.
That's what that means.
So when you're talking about the confusion and the lethargy, I'm sorry if I'm asking too many questions about this.
Okay.
Does that come from the lack of oxygen?
The lethargy comes from the lack of oxygen.
Okay.
Yeah. And so that means that the kid is, it could be lack of oxygen, it could be other comorbidities, it could be dehydration, it could be a kid that's just had a fever seizure, it could be, but it's something we immediately notice, especially about kids.
Sure. Okay.
Yeah. So you should be looking for, and then this has all been publicized before, but just reminding it, blue tinge to the lips or fingertips. And anybody who's unable to stay hydrated. And that's where the pulse ox meter is going to be helpful. In my practice, I like what's called orthostatics, and that's blood pressure and pulse. You measure it when the patient is lying, when the patient is sitting, and when the patient is standing. And there's a physiologic progression that you can see in the numbers. And basically, I look at the pulse, and if the pulse is lower when somebody's lying down, and then when they go to standing, if it's greater than 20 beats increase, then that tells me that that person is likely to be either dehydrated or has a blood loss, or it depends what I'm evaluating. But that's a quick and dirty thing, and you can do that at home with the pulse ox. That's why I'm pushing it.
Well, and I was going to ask that because my guess is a lot of people who might get these home appliances, the pulse ox or perhaps like blood pressure cup or whatever, might be using it, but might really not fully understand how to use it. Unless someone trains them to do it.
That's why the pulse ox is good, because the training would say put a battery in and put it on your finger. Turn it on and put it on your finger.
I could figure that out.
Yeah, it's like low tech. But and I could talk somebody through doing their own, at least pulse-driven orthostatics at home.
Sure.
It would be easy enough. So that's going to give me the information on whether somebody is not hydrated enough and needs to go to the ER perhaps to get fluids. So unvaccinated people have the opportunity to get vaccinated after they are done with their illness in isolation period. Okay, so this was an interesting question that came up in Paul's family. I guess it was friends of his family. So they think you have about 6 to 8 months of immunity from an infection. It might be less. That's only a guess. And it might not be durable immunity if we have a different strain. So the opportunity when you're freshly have gone through the illness and it's in your mind and all the impact on your life and your family, can motivate some people to get immunized. There is the current biological understanding that you have about 6 to 8 months to do that, but it's kind of not very durable data. There's the logistic recommendation that some people wait 3 months. So at pharmacies, they'll say they want to immunize you 3 months after. That has more to do with vaccine availability than medical thought. And then I think the best time to get immunized after an illness is when you're done with your isolation period and feel up to it. And you should just do it, because I think that's when it's going to be in your mind. That's when people who maybe don't have data-driven recommendations are least likely to talk you out of it. So any of those time periods would be okay. The best one is as soon as possible.
I've heard that a combination of having contacted COVID and getting vaccinated might actually provide some of the best immunity.
More durable, more immunity. Effective and more durable. Yeah, totally, because you're hitting the innate immune system, and then we didn't really talk about the more durable immune system, which is like the B cells and stuff like that. That might be next week. So
okay.
So let's see. So go out and get it done. And I don't think you necessarily have to tell the pharmacist that you just had COVID. I think you could just get the shot. There's no contraindication to immunizing a person who has just had COVID, as long as they're past their 10 days of isolation and they're otherwise well.
So they're not spreading it to someone else while they're out trying to get a vaccine.
Yeah, and their immune system isn't so challenged with getting better that a vaccination would be a problem. So, and then the next thing is there's multiple stories in the press. You may have noticed that the helper high for the medical providers is getting kind of like less durable, in that some providers are refusing to treat people who have been unvaccinated who get sick, and there's talk about longer waits in the ER if you're unvaccinated, or ER doctors threatening not to treat the unvaccinated. I don't know what it's like in the rest of the world, but that's not happening here. So anybody that's unvaccinated should not feel any shame. They're not going to be judged. They probably will, the provider will use it as an opportunity to try and answer the questions they might have about vaccination, and will probably recommend it, as they improve. But nobody should be ashamed of, their status, whether they're vaccinated or unvaccinated. So I can't think of any provider in this area who's going to give people slack about it or be disrespectful. It's not going to happen.
Yeah, there's certainly been a fair amount of discussion of that in some of the national media, where there have been some people saying, well, if you're not willing to be vaccinated, then I'm not going to provide help to you. And then, of course, the counter argument to that is a lot of us do things that aren't necessarily healthy. Do I want somebody deciding to not give me medical care because I'm overweight?
Right. It's a totally slippery slope.
It's a totally slippery slope.
It kind of has, at least with the smoking aspect, has been used in this community and failed. So there's no provider that I know of that would say that. Plus, if it's a physician, that's a direct violation of the Hippocratic Oath. We get told all the time, or asked all the time, doesn't that, you're not giving me Norco, doesn't that violate your Hippocratic Oath? Number one, PAs and nurse practitioners don't have a Hippocratic Oath. Number two, if you actually read the Hippocratic Oath, yes, that would be a violation for a physician. If they felt like they were going to be true to their oath, they wouldn't be behaving like that.
Well, and I know this is a big aside and for a totally different show, but I was talking with somebody about the difficulty for people to get prescribed pain medication. Mm-hmm. And in my opinion, a lot of that is driven by kind of like government regulatory oversight and threatening the licenses and things like that of physicians who prescribe, like opioid pain medications and things like that. But that's for a different show.
Yeah, I don't think we've found a workable medium between pain as the 8th vital sign and what makes sense and how we treat people's pain and how we treat all the people who maybe had an opioid addiction problem and now their pain receptors are completely different, and really maybe they need opioids. Maybe there's no other pain control for them.
Right.
Yeah. And do I feel threatened by the government when I prescribe? No. But there are a lot of bureaucratic things. The pharmacists seem to feel threatened, but they're in a different situation. But yeah, that could be a different show.
Sure.
Totally. I'm not sitting happy with the way it is. I feel like on both ends of the pendulum that was interfering with my practice and my relationship with my patient. And I haven't really been able to get to the place that I'm the most comfortable.
Right.
Although I have to say, when I was working walk-in in the days of the opioid thing, ProPublica, you can look up any healthcare provider and see the two most common prescriptions that they give out, and mine was Zithromax and hydrocodone.
Uh-huh.
And that's not the way it is right now, but when I was in this county seeing a lot of people through walk-in, those were my two most commonly written prescriptions, and that was personally horrifying.
Okay. So have we gotten through your COVID list?
Yeah, we have.
So when kind of summing up for today, it's kind of reviewing and over-reviewing. What should people really be doing? And particularly people with kids, who are going to be sending their children to school.
Wear masks, maintain social distancing. Anybody that can get immunized should get immunized. And it's really kind of heartening to see there's a lot of kids in the community getting immunized. Probably by January 1st, they're going to have immunizations available for younger kids. And step up and get it done. To the pregnant women in the community, this vaccine is really safe, and they've proven it's passed through breast milk. So whether you're postpartum or antepartum, so after birth or before birth, and you're nursing, you can pass it along to your child, and that's right now the only way they can get protection, except for social isolating, and just keep immunizing. We had a UHS outreach immunization clinic at Smith River yesterday. They were available for walk-ins for 4 hours. They saw 0 people. That shouldn't be happening.
And we still have over 50% of the people in this community who are not vaccinated.
Yeah, and just take a little drive. My route to the post office from my house brings me past the mortuary, and you just ponder for a minute what that refrigerated truck parked in the back lot is.
Lynn Szabo, physician at large. Thank you very much for...
PA. He meant to say PA.
Oh, I'm sorry. That's what I meant to say. You're right. Thank you for being with us. Okay. I wanted to give you an upgrade.
Is it really an upgrade?
Isn't? Okay. I was thinking of making you sort of like Empress of like Del Norte.
Oh, but, no. Then don't ever do that to medical people. That's just too fine a line.
All right. Lynn, thank you very much for being with us on Health Matters today.
Okay. Thanks.
All right.